Hi, I'm Shannon, and in this video, I'm going to be talking about herniated backs and back pain in general. I am making this video because I have a herniated back, and when I was diagnosed with this, I didn't even know what it was. So I scoured the internet, tried to learn as much as possible and figure out what I should do. And this process was kind of scary and just defeating, so hopefully this video will help you or help someone out there who is dealing with this. I just want to state that I am not a doctor at all. This is just all the information I've learned from my own experience, from doctors that I've talked to, or from other people I've talked to who also have a herniated disc. And below I have different chapters if you want to skip ahead. We're going to be going over what a herniated disc is, my experience, medical treatments, the overall goals to help heal it, things to avoid, other random advice, and physical therapy exercises. We'll get started with what a herniated disc is. So a herniated disc is a spinal injury that occurs when the disc between two vertebrae ruptures, allowing the jelly-like center of the disc to leak out. And this can cause back pain and sciatica. And most common causes for this is improper lifting or lifting too much, sitting too much, or too much bending down. I'm not gonna go too much into what it is because there's doctors online that can do a better job of describing it. So I'm just gonna hop right into my experience. I wanna share my experience, and maybe it's similar to yours, and just show that it can get better. I herniated my disc around 2 to 3 years ago. So here are my MRI images. This is kind of like the profile of my body. This is the front of my body. This is the back of my body. Here's my back. These are vertebrae right here, and then in between each vertebrae are discs. And this is what a disc is supposed to look like, these right here. But down here, my lower back, right here is my herniated disc, right here. You can see it's really squished down and it's going out the back towards the spinal cord. And this one right here is actually a bulge disc. Obviously, it's not as bad as this one. This one is a full herniation, but this one isn't that bad, just a bulge disc here. And then here's another view over in this image, and you can see this is the disc, and right here, all the fluid is kind of seeping out where it's not supposed to be. It's supposed to be over here. So yeah. I have an 8mm herniation at the L5-S1 vertebrae, and it mainly goes out towards the left side of my body. So I get a lot of sciatica in my left leg, and sometimes it's in both, but it's mainly in my left. And for reference, a big herniation is considered a 6 or over, and I have an 8-1, so I wasn't a minor case. I was definitely in a lot of pain. At this point, I was in so much pain that I never left the house. I couldn't sit, I couldn't work, I couldn't do simple things like laundry or even sit on the toilet without being in insane pain. I couldn't even sit down to eat a meal or read a book. I literally ate my meals standing up. I didn't leave the house unless I was going to a doctor's appointment. And essentially I was in constant pain. I had sciatica mainly in my left leg, so I would feel a whole bunch of weird things, like sometimes I would feel like things are crawling on me, or I wouldn't feel my foot at all, or tingly or numbness, or one of the worst ones was when my foot just wouldn't stop itching, and no matter how much I itched it, it wouldn't go away. One time there was a spider crawling on my leg, but at this point I was so used to feeling like things were crawling on my leg that I was like, oh, it's just, my nerve acting up. But I finally looked down and there was actually a spider on my leg. It was kind of funny, I guess. Okay, and during this process, I went to 2 chiropractors, 4 surgeons, a pain management specialist, 3 physical therapists, masseuses, and 2 acupuncturists. So I got a lot of different perspectives and views in the medical field. And now I'm a million times better. I was diagnosed around a year and a half ago. I almost never have pain now, thanks to everything that I will go over in this video. And when I do have pain, I know exactly why. Like if I sit for too long, or if I go on a really long road trip, or I spend all weekend in bed, or if I don't work out or do my physical therapy exercises in a while. But I will get into all of that throughout this video. But point is I'm a million times better thanks to everything I've learned and put into this video. On to medical treatments, and there are more than just these 3 medical treatments, but these are the ones I have the most knowledge about, so that's why I'm going to go into these. So I'm going to be talking about surgery, physical therapy, and the epidural/steroid shot. My biggest piece of advice for surgery is get multiple opinions, because the very first even opinion at all I got about my back was a surgeon, and he was like, you need to get into surgery immediately. It could break off next week. You could lose control of your foot and not be able to walk properly. And at this point, I didn't even try physical therapy. So I was pretty freaked out, but went to 3 other surgeons, and the other 3 all said, well, you haven't even tried physical therapy. You should try physical therapy before hopping into surgery. And from talking to other people who have gotten surgery or just have had a herniated disc and haven't gotten surgery, that overall opinion, and even from the 3 other surgeons, was that you should try to avoid surgery if you can. One surgeon said, try physical therapy for at least a few months, and if you see no improvement and you can't deal with the pain, then we'll talk about surgery. Although one surgeon did say, if I lose control of my bowel system, so if I just start like peeing and pooping without control, then it does become a medical emergency, and then I should go to the emergency room. And it seems like another time that surgery is recommended is when you have drop foot, which is like, if this is your foot and you can't keep it up, it just keeps, like, you're not able to really like walk straight or keep your foot up. That's also another common time when people recommend surgery. Once again, not a doctor. This is what I've learned from doctors and from other people. But I didn't have either of those things. I have control of my bowel system, and I don't have drop foot. I can fully control my foot. So my surgeon said that essentially whether I should or shouldn't do surgery was really up to me and like my ability to deal with the pain. So I started going to physical therapy and seeing how that worked. And this was kind of honestly heartbreaking for me, because I was in so much pain at this point that like I just wanted to go into surgery because I just wanted the pain to stop. Like I thought I couldn't live like this anymore. I can't work, I can't sit, I can't do anything. But surprisingly, physical therapy actually helped pretty quickly and pretty drastically. I thought there's no way that physical therapy, like doing some exercises, is gonna help the amount of pain that I'm in, but it actually did. I was recommended to go to physical therapy 3 times a week, but I actually only went twice a week because, you know, money, it adds up. One of my 3 physical therapists said that it takes on average around a 5mm herniation around a year to heal with physical therapy. And towards the end of the video, I am going to be showing all of the physical therapy exercises I was told to do every day or every other day that have really worked for me. So you can skip ahead or wait till the end of the video to see all of those. Next one is epidural/steroid shot. The injections are administered into the epidural space, which is the area around the spinal cord in the lower back, and the injections work by reducing inflammation and swelling around the nerve roots. One doctor did tell me that it max is lasts around 6 months. Some people say that it helped a lot. Some people say they didn't notice anything at all. I did get one, and I think it did help a bit for me, but I do think it was successful for me because while the shot lasted, I was doing so much physical therapy. So I really attribute my improvement to the physical therapy. Yes, the shot helped me do more physical therapy and decrease the pain a little bit, but I do think if I didn't get the shot, I would have improved with just physical therapy, because the shot is pretty expensive. Okay, these are overall goals or things you're trying to accomplish to heal your herniation. 1, decrease inflammation. 2, strengthen. 3, relax muscles. 4, hydration. 5, decompress spine. And 6, physical therapy. Okay, first one, decrease inflammation. You can do that with drugs, diet, or the shot. Like drugs, I was put on meloxicam, which helped decrease inflammation. Or you can do like over the counter, that could help too. Diet, one person who also had a herniated disc, he said his doctor recommended trying an anti-inflammatory diet, so like no gluten, dairy, things that cause a lot of inflammation. The shot, the epidural steroid shot helps with that. 2, strengthen. A lot of the physical therapy exercises are around strengthening your abs and strengthening the other muscles around your back. One chiropractor told me that she once had a patient that he was a farmer and he had like 3 herniations in his back, but he had no idea because his abs were so strong and really supporting his back. So he didn't even notice that he had 3 herniations. So your abs really like support your back and really protect your back. So almost all physical therapy exercises are around really strengthening your core. 3, relax muscles around. Meloxicam, the drug that I was put on, was also helps relax muscles. Someone said it was muscle relaxer as well. Massages help, yoga and stretching, walking, keeping active and kind of moving all day. Instead of just sitting, it really stiffens up your body. And try to keep moving and keep your body loose. You don't want to get your back and spine to be really stiff. You want to kind of like relax it. And hot and cold therapy also is said to help with relaxing your muscles and also with inflammation. 4, hydration. Try and stay hydrated. In some cases, dehydration for prolonged periods of time can actually cause bulges and herniations. So you want to try and keep your body and your discs hydrated as much as possible. 5, decompress spine. So if you have one of those inverting machines, you can use that. A lot of times people from just sitting all day can get herniated disc or bulge discs. Gravity over time is really compressing your spine. Your disc is between 2 vertebrae, and just as it compresses, it pushes it out. So you want to really try and lengthen your spine and decompress it. If you have an inverting machine, awesome. If you want to get one, awesome. And you just lay upside down for a minute or longer. I actually have a pull-up bar, and I will just kind of like hold on and just hang there for a bit, and I can really like decompress my spine. And sometimes I'll do that before my physical therapy exercises. I guess I kind of thought that if I like hang and decompress my spine a bit and then do my physical therapy exercises, it kind of makes more room for it to like get back in place. And 6, physical therapy. Physical therapy, almost all of those things that I just talked about, physical therapy helps with. Even if you decide to do surgery or the shot or anything else, you still need physical therapy. Physical therapy is so helpful. As you get better, it will start moving closer to your back. It might get worse, but you are getting better. Like when I started physical therapy, I almost 24/7, I couldn't feel my left foot. Sometimes I couldn't feel my right foot either, but almost all the time my left foot was numb. But as I started getting better, I didn't feel it in my foot anymore, and I kind of like would feel it in my calf and then my butt. And then I got like intense pain in my back, or the shooting pain just in my butt instead of all the way to my foot. And because this is such a long defeating process, it's like, oh, I'm never gonna get better. I'm constantly in pain, or like the pain is getting worse, because it's easier to ignore a numb foot than it is to ignore shooting pain. But do know that if it's getting closer to your back, it is getting better. That thought kind of helped me throughout the process, because I found that at my worst, my foot was numb and my foot would itch sometimes. But as I started getting better, I started feeling more shooting pain, like closer to my back. So that's a good sign that you're getting better. So things to avoid: essentially doing anything where you're staying in the same position for too much. It could be if you stand for too long, if you sit for too long, if you lay down for too long, your back really stiffens up and it increases pain. It makes things worse. And especially sitting down causes your spine to really compress and can cause the bulge to bulge out more. Another thing you want to avoid is anything that causes pain or increases pain. Especially in like the workout world, people say no pain, no gain. That is not the case at all with this. If you have a herniated disc, do not do anything that irritates it or makes it hurt more. That will cause more inflammation and more flare-ups. Your back is just so sensitive at this point. So you do not want to push through pain. If something causes pain, don't do it. Stop before it hurts. No bending down too much or lifting things are too heavy, especially when things are on the ground. At my worst, this is my hips. I couldn't bend like this much without excruciating pain. Not to mention something on the ground. My boyfriend bought me a grabber, which really helped me feel less dependent on other people at the time. So I was able to grab, clothes off the ground or just stuff off the ground if I dropped something. So once again, going back to don't push yourself. Picking things off the ground hurts, don't do it. Buy yourself a $10 grabber online. Especially, this goes for anyone, not just people with herniated discs. If there's something far away from you on the ground that's heavy and you're trying to pick it up, get above it and squat. Use your legs. Do not use your back. Don't like fully bend down. Squat down to it, pick it up. Other random advice. Someone told me this: if you flex your abs while like working out, that it really protects your back. And I started doing it while playing pickleball. and I can go play 4 or 5 games now without pain, whereas before I couldn't even play 2 games without pain. That really helps a lot. Or even just like going on a walk, if you flex your abs while doing it, it really helps. And it makes your abs stronger. Try and stay active. Staying active really, one, it helps strengthens your ab, but it also just keeps your body loose and moving. If you can find something that works for you, like walking was one of the only things I could do without like increasing my pain at first. So I did a lot of walking. Or if you have a sport that works for you, awesome. But if it starts hurting, stop. Even in the beginning, all I would do was walk, but I found that even up to a certain point of walking, I couldn't anymore. I was like shutting down and I would need to go lay in bed. So once again, don't push yourself. When you feel it getting worse, stop. Okay, mattresses. I have found that there actually is quite a difference with mattresses. I've tried so many different mattresses. Found the ones that work best for me are kind of hybrid mattresses, and on the firmer side, but not too firm. Sometimes I go from the Bay Area to the LA area, and the mattress here in the Bay Area, I find myself overall way better when I sleep on the mattress here than there, and that mattress is pretty good too. And how we found this mattress is we just went to living spaces, and I just laid on all the mattresses and really felt which one felt the best on my back. And we got that one. And I can link down below the exact one I have, but you know, what works for me might not work for you. So I would advise going to a mattress place and just trying out a whole bunch. Next is acupuncture. I went to 2 different acupuncturists and I tried it 3 times, but I didn't really like it. I found my whole body kind of just tensed up a lot. Although my physical therapist did say that he found that patients actually really did improve quickly when pairing acupuncture with physical therapy. Wasn't for me. I didn't like it, so I stopped, but it might be for you. I just think it's not for me. So here's my physical therapy exercises, at least all the ones I could remember. This prone press up is one that I'm supposed to do 100 of every single day, and the thought behind this one is if these are 2 vertebrae and your disc is bulging out this way, you kind of go like that, and you're kind of trying to nudge it back in place over time. So like doing that 100 times a day, kind of like we're trying to force it back into place. So yeah, I'm supposed to do 100 of those a day, and a lot of ab workouts. Here, you can screenshot this. But remember, while doing this, do not push through pain. For example, prone press up. If you can only go a little bit off the ground without pain, stop there. Do not push through to a full cobra if your back is feeling pain. And with almost all of these exercises, you don't want to have an arched back or a hunchback. You want to keep your spine in a neutral position. And for almost all of these exercises, I did 3 sets of 12 every time I did this. And let me know if you have any questions about that, or please let me know if you have any other exercises that have really worked for you. If you have advice or you think I missed anything, please add it below, because if you have a herniated disc, you know how horrible it can be, and the more advice, the better. And if you have a herniated disc, I truly hope you get better, and I hope this video helped. So thank you so much for watching, and have a good day.